In this video, I'm going to show the best exercises to help fix urinary incontinence and improve bladder control. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over 4 easy exercises that can give long-lasting improvement for urinary incontinence. A note, each one of these exercises works just a little bit differently. To get the best results, go through them all and use what works best for you. With that being said, let's get started. So let's jump right to stopping the leak by strengthening the muscles that support the bladder and the pelvic floor. This exercise we can do seated. The first thing that you want to do is just take a deep breath in and then let it all the way out. Once you've let out all that air, what you're going to do next is mimic the process of clamping down and stopping the flow of urination midstream. So just engage those muscles as much as you can. A sign that these muscles are weak is one, this is going to be very difficult to do, or it will feel like the muscles quiver or sputter just like this. But do the best you can to engage those muscles, clamp down and hold this comfortably for 3 to 5 seconds. Release it and then repeat this whole process 5 times. And with each repetition, just build into it a little bit more. Essentially what we're trying to do is build a mind-body reaction, which is going to help improve bladder function, but also help us control the flow and stopping of urination. So once you get a very good handle on that, let's focus on another movement that's going to target some more muscles. So we're going to take a deep breath in, let it all the way out. We're going to clamp down to stop urination, but this time around we're going to focus on the area around the anus. We're going to clamp down with those muscles like we're trying to stop defecation. I know this is pretty graphic, but there's no better way to explain it. So we're going to clamp down like we're stopping urination and also defecation. Hold this 3 to 5 seconds, release, repeat this 5 times. So the last movement is really going to take this one to the next level by targeting the area right in between the sit bones. It's probably going to be a lot easier for you to isolate and target this area if you roll up a large bath towel and just place it right in between your sit bones. So what we want to do essentially is take a deep breath in, all the way out. We're going to clamp down to stop urination, defecation, and this time around we're going to take that area right in between the sit bones, right over the towel if you are using it, and just pull it straight upward towards your spine. At this point, you're going to feel a ton of muscles across the pelvic floor start to engage, so build into this as much as you can. Hold this 3 to 5 seconds, release, and then repeat that 5 times. When you do this exercise, you're probably going to find that one certain movement, like maybe clamping down for urination or defecation, is the most challenging. At that point, treat that like your weak link and throw more repetitions in to make sure that you're really helping to strengthen those muscles. Here's another exercise that you can do seated to help strengthen the muscles that support the bladder and the pelvic floor. For this one, we just need a large rolled up bath towel. So just roll it up, place it on your chair just like this. So what we're going to do is start with one cheek on the towel while the other side is off. Essentially what this is doing is creating a wedge, lifting one side's hip and pelvis higher than the other. What we're going to focus on is the low side, the side that's off the towel. So what I want to do is engage the muscles on that side and drive it straight upward to the point where my sit bones will be level. But focus on moving through your hips, through your pelvis. Don't lean away like this, because the more that you go up, the more that you're going to feel a deep activation of the muscles across the pelvic floor. Once you feel that, hold this comfortably for about 3 to 5 seconds and then slowly go in reverse. You're going to take the sit bone on that low side and now press it downward into the chair. I like to go a little bit further with it and press down to the point where I feel a deep opening stretch across my pelvic floor. So the nice thing is, as we go up, we're going to help strengthen muscles, but as we go down, we're going to help lengthen them. We get the best of both worlds. But try to do this about 5 to 10 times in both directions. And with each repetition, trying to build into it just a little bit more. To take this one to the next level, you can add in a breathing Kegel exercise. So this one is pretty straightforward. As we go up, what we're going to do is take a deep breath in, hold that, and as we go down, we're going to exhale as much as we can. You'll notice that you're going to target the muscles a little bit differently, and this one may just give a little bit better of a result, so definitely give that one a try. Just remember, when you're done on one side, take the towel and switch to the other side and repeat to help keep everything imbalance. So here's a really easy exercise that you can do daily in bed or on a floor that will help fight incontinence and help improve bladder function. For this one, we just need something soft that we can squeeze our knees into. I find that using a small therapy ball like this works the best. They're pretty inexpensive. You can find them locally at any sporting goods department. If you would like to get one online, I will leave a link in this video's comment section and description. But if you don't have one of these and can't get one, you can also use something like a volleyball, a soccer ball. If you don't have anything like that, just take a large pillow and fold it in half and place it in between your knees. But what we're going to do is start flat on our back, have our legs roughly hip width apart, knees bent, feet flat. Let's start off by taking our knees and pressing into the object, our ball right here, as much as we can until we feel a really deep activation of the muscles in the hips that works inward towards our pelvic floor. Once we feel that, hold this comfortably for about 3 to 5 seconds, release it, and then repeat this about 5 to 10 times. And with each repetition, challenge yourself to press in just a little bit more. So let's take this one to the next level and now focus on the muscles that are directly related to bladder function. So this time around, what I'm going to do is press my knees inward as much as I can until I feel the activation of the pelvic floor muscles. I'm going to hold this and now take a deep breath in and then all the way out. Once all the air is out, I am now going to mimic the stopping of the flow of urination midstream. So I'm just going to kind of clamp down with my muscles and just try to close off the flow of urination. At this point, you should feel a ton of muscles across the pelvic floor start to fire. Hold this one about 3 to 5 seconds and then release it. On the next repetition, try to build into it just a little bit more and repeat this about 5 to 10 times. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. So here's another really good exercise that you can do daily in bed or on a floor. This one is called the Kegel bridge. What we're going to do is start lying flat on our back with our legs roughly hip width apart, knees bent, feet flat. Let's start off by doing our Kegel breathing exercise. So we're going to take a deep breath in all the way out. Once all the air is out, what we're going to focus on doing is clamping down, mimicking stopping the flow of urination midstream. So when you do this, you should feel a deep activation of the muscles in the pelvic floor. Once you feel that, you're going to hold this and now take your hands, put them right on your hips, and drive your hips upward to the point where your body is in a straight line from your knees to your hips to your shoulders. In this position, you're going to feel a ton of muscles start to fire. The core, the back, your butt, your legs, but more importantly, across the pelvic floor. Hold this one comfortably for 3 to 5 seconds, relax, take a breather. On the next repetition, try to build into it a little bit more for 5 to 10 repetitions. But afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. So to take this one to the next level, we can mimic those movements that we did in the first exercise of this video. So you can clamp down, trying to stop the flow of urination, but you can also focus on the area around the anus, trying to stop defecation. You can also take the area in between your sit bones and just try to pull that upward towards your spine as much as possible. You can do all 3 at the same time. I would just focus on the weak links because one of those positions is going to be the most difficult, and at that point you want to throw more repetitions in to focus on strengthening those muscles. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.